Okay, let's talk about gallbladder disease. So what is the gallbladder? The gallbladder is an organ that sits just under your liver that stores bile. It doesn't make bile, it stores it. So your liver makes bile. If you're fasting, you're not eating, the bile backs up into your common bile duct, into your gallbladder where it gets stored. If there's an imbalance between the bile acids, water, salt, and cholesterol, then you can develop what's called gallstones, which are basically stones within your gallbladder. Those stones can be problematic. So in patients who have stones that have symptoms because of the stones, or even worse, infections or inflammation from the stones, there's an indication for surgery. So what are the symptoms of gallbladder disease? Most patients will complain of right upper quadrant pain that radiates to the back. It's usually a crampy pain. And very specifically, it's a pain that gets worse, typically, not always, but usually with fatty foods. So if somebody has pain on the right side that goes to the back, especially after they eat, especially after fatty foods, you want to work that patient up to see if they have gallbladder disease. The best test to see if somebody has gallstones is called an abdominal ultrasound. So they put a probe, they look to see if there's any stones in there. If you're coming in with severe symptoms, more than just pain, such as fever, vomiting, then they can also look to see if you have an infection of your gallbladder. If you have an infection of your gallbladder, it typically has to be addressed more rapidly. Either surgery at the time of admission to the hospital, or at the very least, you have to calm down that infection with a course of antibiotics. Now, how do we do the surgery? So today, almost everybody does this operation minimally invasively. So what does that mean? Either laparoscopic or robotic with small incisions and a camera. I do almost all my operations robotically. With this operation specifically, I have a way of doing it robotically where we hide the incisions underneath your waistline. If you're ever out with your shirt off, you won't see the incisions, anything below that waistline. The operation is typically done as an outpatient. You're in and out of the hospital the same day. You're usually back at work within a week, and you're completely back to normal at about 4 to 6 weeks. If you don't get your gallbladder taken out, if you have stones, there are concerns. So you can develop pancreatitis if those stones slip into your pancreatic duct, or cholangitis, which is an infection of the bile duct in the liver. For younger patients that have stones, even if they don't have severe symptoms, I typically offer surgery for them. I often get asked, well, what are the side effects of gallbladder surgery? Well, number one, the most common operation that general surgeons perform is what's called a cholecystectomy, or removal of the gallbladder. 95–96% of the time when you do it, you won't even know that it's gone, aside from the incisional pain and the pain from surgery. About 4 to 5% of patients get what's called post-cholecystectomy syndrome, meaning they're getting symptoms from having their gallbladder taken out. So the gallbladder stores bile, it doesn't make bile, but now there's more bile going into your intestinal tract. 95% of the time, your body is very good at picking up and learning how to recycle it better or control it better. And about 4 or 5% of patients, they need more time for that adaptation to occur. So those patients will get medications, things that bind to the bile to decrease the loose bowel movements that you might get after taking out your gallbladder. The operation is very safe, and if you go to somebody who knows what they're doing, it should be a very routine operation.